if we can talk about the housing a little bit, now, especially with the situation that we have these days with the economy and others, do you see a big challenge or big problem for Delaware for in terms of the housing and affordability of housing, which you kind of mentioned that there are already issues, but specifically to the housing, are there any plans from your side or any maybe collaboration that you do with other representatives?
Yeah, absolutely. So I would urge anyone who hasn't read the Delaware State Housing Authority's Housing Needs Assessment to do so. The executive summary is probably 10 pages, very easy to understand, and really gives a comprehensive understanding of what is going on with Delaware. 8% of Delawareans are living in incredibly insecure housing, whether they're couch surfing or staying with friends. We have the highest amount of family homelessness there's ever been. So that means children. And so I was very eager to look at the recommendation. There is a really incredible lack of housing stock in Delaware. Affordable homes are not being built. Well, homes that a working family, people who are firefighters or nurses are doing really essential work in our community are not able to afford to live there. And so I think we should be really thoughtful about incentivizing
Mhm.
what we're doing to build these affordable homes. How are we working with developers to really urge them not to be focused on the luxury home market or the listen, we all love visiting down in Sussex at the beach, but how are we incentivizing them not to be focusing on building that, but to be focusing on workforce housing? I was really impressed with the work that Representative Larry Lambert and Newcastle County did up in Claymont to really focus on workforce housing. I think that is a wonderful development. I think
Mhm.
being thoughtful about where it makes sense to build more workforce housing is also something. As much as I think we all want to build near Middletown, anyone who has been driving near Route 1 at any time during rush hour knows that we have to also make sure that we're keeping up with the transport infrastructure. So I think not only incentivizing the housing, but making sure that we are looking at the problems around that. What does that mean for schools? As you mentioned, if all of a sudden a bunch of new developments are built, how are we keeping up with the schools? How are we keeping up with the roads? So housing kind of touches on every issue. I think because it brings everything there, you start with it and it dominoes. But I do think that really incentivizing workforce housing is an essential piece of this.
Yeah, I mean, I think the issue usually the struggle that I have, knowing we don't really have clear answers for the near future, because the things are changing. Like COVID
Yeah.
was, it was brand new. Like I don't know why we had to go through it in our lifetime, but it's happening. Not everyone who live their lives in this world. They didn't have to go through everything that we did. I think that it was an extremely important experience, maybe, although it has its own issues and challenges and problems, but it changed everything. It changed the way that we kind of live today. It changed our habits. It changed our expectations. So, and with that, we can only do so much planning, I guess. And I always say that, as much as we expect things from state officials or federal officials, everyone individually have to take responsibilities to make things better. So it's just like you can be in charge of your district, but you can only do so much on your own, right? So everyone needs to have that ownership and accountability. And that's the only way that, only time that we are going to be able to have a better impact. Now,
And
um,
something I love about Delaware is that I can't imagine what it's like to live in a big state. In Delaware, five people can get together and say, this is something our community needs and really make a difference. We all have our legislators' cell phone numbers. We all know our neighbors. That's something that's really amazing about Delaware. You're right. We can really do things in community so much more.
yeah, yeah, absolutely. Now, Pike Creek and Hawkasson probably don't have this issue as much, but overall Delaware does. Crime is another big problem for Delaware. Again, you are on the luckier side of town. I live in Greenville, 2 miles or 2.5 miles from downtown. Uh, there are times that I'm worried about where I live. There are times that I'm okay. But the crime for Wilmington especially is a bigger problem than any other part of the state. But overall, do you think there are things that we can do better on the crime issues and managing those issues?
So I have been lucky enough that most of the work that I've done with the police has been with the victim services, with people who are the ones who's there holding someone's hand when there's been a murder or gets called out when you have been abused by a family member. So I will admit that I am used to dealing with people who are in that being victimized by very serious crime and the people who work with them. And I know that those things are really life-changing.
Mhm.
Luckily, I think when we are talking about crime, we do have to distinguish the type of crime. It is really good that after COVID, homicides are reducing. I think everyone is really happy about it. I think when people are talking about crime, they're talking about more the property crime. Is that what you're referring to?
I think the issue on like the homicide is a huge problem in Wilmington. So I think per capita, we are still in the top five or top six in the nation. Uh, I know it did get better, but I don't think
Yeah, the trends go in the right direction, but it's not
we
where we
went
want
from
it to
number one to number five. I think
be.
it's something like that. I don't have the latest, but this was maybe a couple months ago. I know that there was a big impact on like in a better way, but there's still the drug trafficking and uh, just like what's happening on the east side of Wilmington is still it's a problem. Like I go to Sunday breakfast mission. I try to go there on a regular basis, um, and I never feel safe.
Yeah.
Right. So even just parking your car or being at a red light is sometimes challenging. So those are the one that I was like. I think the police department probably needs more support, in my opinion, because like especially when the issue is a little bit out of control, so you are relying on them on those individuals even more. Like the development that I live in, we pay for one of the I think Newcastle officers to be in our development. Um, just because it's too close to the city. So, and I don't think that's needed if we didn't have the crime issue. So it's kind of, I always tell people like yourself who are on the show, who come to the show, I choose to be a Delawarean. So I wasn't born here, but for the last 25 years, I came here and I never left. So, and I love this state. So, and you were on something earlier, like us being a smaller state that has advantages and disadvantages. But advantage would be we are able to reach out to not just the officials, the state officials, but also other people and then communicate better. So then we can actually do certain things better. I always, when things happens, I'm like, okay, are we managing this better than other states? Are we in the top five? Are we in, top seven? And it doesn't happen sometime, and it just breaks my heart. And that's why I'm also personally interested in, working with our state officials closely, especially being a healthcare provider, healthcare network.
Yeah.
It's putting more responsibility on our shoulder, and hopefully, we can see better improvements. And I know uh, John Carney is going to be the next mayor of Wilmington.
Yeah,
So
apparently he's running.
yes, it's kind of funny in a way because I asked him why he didn't run for the Senate, and he's like, "Oh, I'm kind of like done." And you can actually, I think it was Sean. He was in February, right?
February,
Yeah,
yeah.
last year February he was with us, and he's coming back this time. I'm going to ask him how come he didn't listen to me. So, but I think now he's instead of running for the Senate, he's running for the Wilmington mayor position, and I think he'll be the next mayor. And I know that he's able to hopefully probably do more. What we already have from the current mayor, he can probably add more to that, and then we'll be in a safer place. Now, overall, Monica, if you want to highlight your campaign, what are your main focuses?
So I would say that really, as a working mom, I'm very interested in making sure that we have supply of childcare, making sure that it's supplied, it's affordable. I know when we were going through the pre-K process, there wasn't really any support to help you navigate it. I want to make sure the parents feel comfortable navigating that. And I will bring up the dreaded summer camps. I would love to see more encouragement of summer camps and really summer childcare for children. I am also deeply interested in education. We talked about that a lot. I think it's something that a lot of parents are really concerned about, making sure that we have a school system where you feel like your children, yes, are getting wonderful math, writing, and science skills, but also feeling like they're becoming engaged citizens and becoming really active, their civic skills and becoming part of the community. That's something I'm really interested. And I will say, based on my background, I'm very interested in being an advocate for the most vulnerable Delawareans. I do a lot of volunteer work with people in crisis, a lot of work with people in crisis. And I think there are ways in which, as you were speaking about with crime, victims can really fall through the cracks sometimes. It can be a frustrating and confusing experience to be victimized. I want to make sure we're doing everything we can to support them.
No, that's yeah, those are important. Now, again, from the one of those surveys that I'm actually running these days, one of the maybe not so surprising because this is kind of consistent in other places. I see our current administration, the approval rate for our current for our presidents right now, it's one of the lowest. Uh, do you see that as a challenge for Delaware and him, especially being from Delaware? Um, I would like to hear what you have to say. Like, do you think that would be a problem for people who are running for in Delaware?
I would certainly hope that at the local level, there's really the sense that we can get to know each other and that we can work together in a way that it's very hard to at the federal level. I admit, even myself, sometimes I turn on the news about what's going on in federal politics and I think, oh, this again, this gridlock, this frustration. But the great thing is that there are really amazing things happening at local level. I want to spot everything from down my street. We've been able to get a red light camera that
Mm,
people always wanted, to everything from now that we have a minimum wage that has increased, which a lot of people were campaigning for, to paid family leave. All of
mhm,
these are things that people got together at the small local level. At Marbrook Elementary, over not too far on Centerville Road, a lot of
mhm,
parents got together and said, we want to keep a Spanish immersion program open. I love that Delaware is really an example of community coming together. And
mhm,
so what I have found that at the doors, people don't really want to talk about Biden or Trump. What they want to talk about is what's going on locally. They want to talk about traffic. They want to talk about speed bumps. They want to talk about schools. So I hope that we can really have a campaign where people are very interested in those substantive issues. But as we're close to the election and you can't avoid it, maybe I would be very curious how your survey changes in September when you can't get away from political news.
With respect to healthcare, uh, we've got some of the greatest capabilities and technology in the world in this country. We've got great medical staff. The nurses, the technicians are so dedicated. They're so dedicated. They're overworked, understaffed, and underpaid, many of them. And the health system is very complex. It's 17+% of our GDP, touches so many different parts of our economy. Each and every one of us is a patient, so it affects us. And we have to do better. We have to do better with how we spend the money. It's a very expensive system. There are many people that are left out of reaching care. And the objective is to make sure that every person in this country has access to high quality healthcare that's affordable. And for those that can't afford it, I believe we have an obligation to help those in need. I mean, that's just the generous society and how we are as Americans. But it's a very disparate, dysfunctional, fragmented system. The care that you may get in a university or large hospital system in a more suburban city area may be very different than the care that you're going to receive in a very rural area. And so I personally believe, and one thing that I want to work on and have, studied and worked on for years is the integration of American healthcare, so that no matter where you are, that you're getting the same healthcare, and it's really working towards an integrated health system that is a public, private, and nonprofit combination.
So with the health systems, I guess with the healthcare issue, I think one of the biggest problem again is the expenditure and how much we spend. We own private practices, and I also am the managing partner of American Surgery Center. You are probably familiar with that, right on Folk Road. And one of the big problems that we initially discovered is how we get paid versus how the hospital systems are getting paid. So for the same procedure, with the same surgeons, when they do it in our surgery center, I'm going to give the examples from Medicare since they are public. So the gallbladder surgery would be about like $2,200 for the facility. And right now, locally in Delaware, gallbladder surgery averaging about $12,000 in the hospitals. So that's about 6 times more. And every time there is a huge discrepancy for the same service being paid from hospital to the non-hospital systems. It's one, of course, I'm a businessman, and I'm going to, of course, look after my business. But then from the social side and the community that we live in, now I know that Medicare patient is going to be responsible if they don't have a secondary insurance. They are responsible for 20% of that fee. And the 20% of the 12,000 is almost higher than 100% of the fee that we get paid at the surgery center. So, and with the hospital system being the lobbying being so strong, going through that is, and also us being able to compete with those systems from the private business, it's a lot to do. From for your campaign standpoint, between the hospital and non-hospital providers, do you have any plans for those groups?
For the hospital and non-hospital providers?
In terms of support private practices, maybe I can just rephrase the question a different way. Like private practices, just like my practice and all of my clients, we are competing with these huge, giant systems with very limited resources. And the question is, do you have any plans to better support the private businesses in healthcare?
Yeah, so payment equity. And we've dealt with this for years in healthcare, government, fighting for reimbursement for Medicare. Just many practices and facilities have struggled for decades, literally, to not only get paid for the services they provide through Medicare, but also just to be able to cover their costs. I mean, many times, I know most of my career and what I did, we didn't cover costs with Medicare. It was the private contracts that were able to sort of subsidize the Medicare community. Some people opted out of accepting Medicare, but quite frankly, when I was in the operating room caring for patients, I never looked at that. I was involved in the business end of it. But once you're a physician caring for patients, my view was, the first thing priority is do what's in the best interest of the patient, and the last thing you do is in the best interest of the patient, and everything in between. You don't look at who can pay and who can't. You just care for the patients. Unfortunately, in business, you can't keep the doors open, and you're providing a service to the community and to every patient. So yeah, I mean, Medicare is a mess, and they usually look to the providers to try to keep Medicare afloat, but it's really a symptom of the dysfunction of of government funding and of our health system right now. So that's part of instead of, as I talked about downstream solutions, that's really what Congress has been doing for decades, is really dealing with downstream problem solving instead of looking at the whole system and figuring out how can we fix the system. So that's where I'm talking about working on creating, integrating the system and creating efficiencies.
Wait, I guess maybe put it out there for those may not really kind of see this the way that we do. finding the problem, being problem oriented, I mean, solution oriented, like with the upstream and the downstream. So that I think that's a good way to probably help people to process this. And I think there are a lot of things that I know there are a lot of things out there that we are able to do. The thing is, again, how strong certain lobbying efforts are in different industries, and healthcare, unfortunately, is one of the big ones. And some of these things are difficult. So, but that doesn't mean that we should stop trying, because that's what we have done from United Medical ACO standpoint. So as a private ACO, there are, as you may know, there are 4 ACOs in the state of Delaware, kind of like main core business being in Delaware. 2 of them are hospital systems, and one is us, and there's another private one. And because we are competing with the same metrics, with, again, limited resources, but in program year 22 for Medicare, we were #1 in Delaware and number 17 in the nation out of 482, I believe, total ACOs. So it's doable. So that's what I'm trying to say. But it's just like it puts a lot of pressure on us, and then maybe it makes us stronger. I don't know. But what if people are not willing to do? Some of them are joining the hospital system. I'm sure a lot of your friends who used to be in private practice, they joined the hospital system just because they didn't have an option, right? So that's what we are trying to kind of hoping that we can eliminate those, so that would help the total cost of healthcare. Now, education.
One thing I just want to mention too is that well, go ahead. I apologize to interrupt.
No, feel free. I mean, very good.
No, it's really healthcare. It's a challenge. It's solving the problem upstream. It's looking at it system wide. And one of the reasons why I'm an independent is because I don't have an allegiance to the party. I can do, and I always have, but not being part of the Democratic or Republican Party, I'm going to do what I think is in the best interest of Delaware and all Americans. And also, I talk about the influence of money. You mentioned about lobbyists and the lobby power. That doesn't affect me. I've eradicated the influence of money from my campaign. I will not take money funds from anybody or any lobbyists, and that really I'm here to do the job and to get it done regardless of who, what lobby tries to put pressure on us. They really have no influence over me because I don't need their money.
Our U.S. foreign relationships, one of our surveys that we had, most people, I believe the number was about 78% of the people right now, they don't believe that the foreign relationship actually is, they don't believe that we are doing a good job. Now, having this picture in place, of course, this is Twitter, so then you have to make some adjustments. But if maybe it's not 78% or 73%, maybe it's 60%, but it's vast majority. They don't agree with what's happening today. What are the plans that you have for U.S. foreign relations?
Well, as a prior service member myself, there are 3 generations of service in my family. My father moved to Delaware in 1973, stationed here through the Air Force. And so he served 26 years. He was a Vietnam veteran. He actually lost his life back in 2019 from his exposures to Agent Orange. He had all of the cancers and all of the health issues, and he really died without his dignity at the hands of a very broken VA system. And so I'm very passionate about our veterans issues. I served in support of Operation Desert Shield and Desert Storm in the early 90s, and I have 2 sons that have followed the family legacy of service. The younger of those 2 boys, he just actually got out of the Air Force, and the recent tragedies that we've seen over in Jordan, my son actually was deployed to that area of the world, and it could have very easily have been someone showing up at my door to let me know that my child had been lost over there, and of that very tragic moment. And so when it comes to our men and women that wear the uniform, I will be a very strong advocate to make sure that whatever the U.S. involves itself militarily overseas, that we do right by our service members. So I have a passion to make sure that I'm going to be very vocal about foreign affairs and how we interact with other countries.
Now, from the same from the foreign relations to the border security, they are kind of like related in a way that both how we are actually how we are interacting with other countries, but also how we are protecting our countries here. So recent development, there are a lot of issues in the south border. And what would you do as a congresswoman once you are there? What are the things that you would be able to do to change certain things? Because right now, 68% of the people, they believe that U.S. border security should be increased. That's the poll that we have. What are the things that you would be able to do?
Well,
Or
I think that's
what are the things that you feel like that's not being done correctly right now?
That's a very important question because people's sense of security is important. And I think I've heard that a lot along the last couple of administrations as to what we do about what appears to be a crisis at our southern border. I certainly believe in a couple of different things. I have children who are firstborn natural citizens in this country, and I'm very sensitive to the needs of the immigrant population. I think that in order to really effectively talk about how people enter this country, you have to be cognizant of the fact that immigration is far more encompassing than just people who are entering our country illegally. I think that if people are seeking asylum because of whatever reason, that was where our country was founded. We have immigrants to this country because people needed to have that ability, especially in times of conflict. And so I think that we are mismanaging how people are entering this country. I think that conversation has a sense of urgency, and that we need to be humane in our approach on how we execute a border security policy. There are a lot of folks that are in this country, even legally now, that don't have a pathway to citizenship, that I think that bureaucracy and red tape could be immensely streamlined to give people viable pathways to citizenship in our country. So I will be a strong voice in that conversation as to what we can do to secure our border and our national security, and also give people who are seeking citizenship in this country a streamlined pathway to that citizenship.